Hi, this is Dr. Chirag from Refine Skin and Body Clinic. Today we're going to talk about hair restoration. At Refine, we have been focusing on hair restoration. We still do offer a variety of treatments. Now, for you listeners out there, if you're worried about hair loss, your hair is thinning, you're losing hair, you've got patches of hair loss, whether it's on the scalp or the head or on the beard for the men, first thing is to come see the doctor. Hair loss has many different etiologies, what we call, or issues. It can be due to hormonal issues, male and female pattern hair loss, for example, which happens due to hormonal changes, or there could be something more sinister, medical issues. Sometimes the medication you've been prescribed by other doctors could be leading to hair loss. So before we treat hair loss, the first thing is to come in and understand what the problem is. We'll do something called trichoscopy. We'll look at the scalp or the area of concern with our sort of dermatoscope or magnifying glass to find what the issue is. You may need some blood tests to be done, whether we're checking your iron levels, vitamin levels. This is the first step. So consultation and investigations. Then we can go on to treatments. Conservative treatments might include things like use of topical minoxidil, oral minoxidil, or finasteride. These are medications that should be used under doctor supervision. We can use strengthening shampoos or conditioners, again, depending on the condition we're treating. If you're a candidate for hair transplant, this can be done at the clinic. The procedure is simple. You might be watching my video in the background where I've had it done. I recently had it done in December in India, and actually also trained in it. Hair transplant includes the extraction of what we call follicular units from the scalp, from the back of the head, or any other donor site. It could be on the chest, but mine luckily was on the scalp or back of the head, which is similar to the hair on the top of my head. So the first step is to draw the area required where the hair loss is happening. Then we put in anesthesia to numb the area, and then they take out these follicular units. So they've used a punch or a biopsy. They go to a certain depth to help remove these units of hair, which are then separated into what we call 1, 2, or 3, or 4 follicular units. And then the drawn area, we then implant them into a particular sort of location. I've had about 6,000 grafts put into my hair. Now the steps through this, there was a bit of crusting initially, then it went slowly to a shedding phase. The full effect of my hair transplantation will take about 6 to 9 months. So you'll see my videos and photos over time to see the progress of the hair transplant. But if you're interested, do come in at Refine. We are looking for some candidates to help us get this commissioned. So if you'd like to support us through this journey, we look forward to your support and assistance to help you restore your hair. Thank you very much.